everyone, my name is Ayushi Kasotia, and today I will be presenting on the impact of the current nursing shortage on global health. As someone who aspires to become a nurse, I was curious about the critical role that nurses play in healthcare. So here's a little brief introduction about me before we start. I'm a rising junior at Stephen F. Austin High School in Sugar Land, Texas. I'm on the varsity golf team and founder of a goals chapter which provides STEM resources to underrepresented groups such as women and the specially able. I also serve as a secretary of Spanish National Honor Society, junior activities coordinator of Mu Alpha Theta, and vice president of Austin Accelerated. Currently, I volunteer at a local hospital and mentor at the First of Greater Houston, teaching golf and life skills to at-risk youth. I'm passionate about neonatology and pediatrics and hope to become a nurse in one of these specialities in the future. So before we go any further, let me clarify what a nurse is. So according to the Cleveland Clinic, a nurse is a trained and licensed healthcare professional who provides compassionate, patient-centered care. Nurses work together with other members of the medical team to take care of you when you're healthy and when you're sick, whether it's a temporary infection or an illness that spans years. So the nursing shortage is defined as a situation where there's a high demand for registered nurses, but not enough qualified individuals to meet that demand. This shortage can seriously affect the quality of patient care. It puts a strain on the healthcare system, causing longer patient wait times and higher healthcare costs. It can also impact public health outcomes and contribute to job dissatisfaction among nurses. This makes it harder for the healthcare system to function effectively and for patients to get the care that they need. By 2030, up to 1 million nurses are expected to retire, which could seriously impact patient safety. Losing these experienced nurses creates a risky gap in care, as new nurses and doctors rely on their expertise, intuition, and leadership. This highlights the urgent need to find ways to support and retain these crucial healthcare professionals. So my interest in this topic began through conversations with family and friends working in healthcare. While volunteering at various hospitals over the past summers, I saw firsthand how the shortage of nurses impacts the system. During the Longhorn Nursing Immersion Summer Camp, I was surprised to learn that the UT Austin School of Nursing only admits 60 to 65 students each year due to the lack of nursing educators. This is a major factor contributing to the overall nursing shortage. Additionally, I had personal experience with this issue in India. My paternal grandfather fell ill, and there weren't enough nurses to take care of him, resulting in increased stress for my family and I. This first graph on the left over here addresses the primary causes of the nursing shortage, with burnout, poor working conditions, and inadequate pay being the top three. Burnout is a leading cause, with about 75% of nurses citing this. Nurses often work long hours in high-stress environments, leading to physical and emotional exhaustion. Poor working conditions come next at 60%. These include inadequate staffing, lack of necessary resources, and unsafe environments. These issues make it hard for nurses to provide quality care and keep themselves healthy simultaneously. The last major cause is inadequate pay for nurses, around 55%. Many nurses feel that their salaries don't match the level of skill, responsibility, and risk that their job involves. And despite their critical role in healthcare, low pay is a big reason why many nurses leave the profession. According to a 2023 State of Nursing report from nurse.org, 52% of nurses feel that their hospital does not pay nurses with similar experience equally. And as you can see from this third graph, a lot of nurses across different specialities feel underpaid, which is the root of the dissatisfaction. This figure shows how happy, or rather how unhappy, nurses are with their jobs. Only 28% of nurses are satisfied with their current job. That's barely over a quarter. Another 33% are neither satisfied nor dissatisfied. This means a lot of nurses are just on the fence, not sure how they feel about their careers. They could easily become unhappy and leave if things don't get better. The most worrying part is that 39% of nurses are dissatisfied. That's a significant chunk of nurses who are really unhappy with their jobs. And this high level of dissatisfaction leads to more nurses quitting, making the shortage even worse. So I had the privilege of interviewing two experienced nurse practitioners, Mrs. Sheila Sai and Mrs. Courtney Tapnio, who have each been working for over 15 years. They shared valuable insights into the nursing shortage, particularly how it worsened during the COVID-19 pandemic due to the surge in patients with unpredictable demands. One of the most compelling points they made was that the nursing shortage affects bedside nurses more than advanced practice nurses. This distinction intrigued me, so I asked them to explain further. They shared that bedside nursing, while very rewarding, can also be tiring. With many opportunities available for nurses today, many choose to explore different roles within the profession. This can have countless implications for the healthcare system, affecting everything from patient care to overall system efficiency. So now that we've discussed the causes of the nursing shortage, let's look at the real impact of this global health crisis. So first, higher nurse-to-patient ratios means that each nurse has more patients to care for. This can lead to several problems, such as increased likelihood of healthcare-associated infections, pressure injuries, medication errors, and patient falls. Beyond patient care, the shortage also affects nurses themselves. Many experience increased anxiety, depression, and burnout due to the high pressure and long hours. This can lead to physical and emotional damage, making their jobs even more challenging. The strain on the healthcare system is also significant. With fewer nurses, there is even more pressure on the remaining staff, which can lead to longer wait times for patients and higher healthcare costs. These extra costs are needed to try to compensate for the lack of nurses, adding another burden to the already stressed system. Looking at these graphs, we can clearly see the impact of this global health crisis. In 2022, 81% of nurses reported feeling burnt out in the past year, a slight improvement from the previous year, but still alarmingly high. Furthermore, 81% indicated that their mental health had suffered, only slightly better than the 83% in 2021. This figure shows the challenges nurses face, emphasizing the need for changes to support their well-being and help them provide high-quality care. In conclusion, the nursing shortage is a serious problem that affects global health. It leads to lower quality care, higher patient risk, and greater health disparities, making it harder to achieve universal health coverage. To strengthen our healthcare system, we must support nurses more effectively. They are essential for the health and well-being of everyone. It's time for policymakers, healthcare organizations, and communities to take action and make real changes to support and retain our nurses. Investing in their well-being and professional development will help create a better and more equitable healthcare system for all. These are the sources I used in order to complete my presentation. Thank you to Mrs. Sheila Sai and Mrs. Courtney Tapneal for taking time out of their busy schedules to speak with me. I also want to express my gratitude to my family and friends for supporting my pursuit of a nursing career and always being there when I needed to talk. A special thanks to Johns Hopkins for providing me with this incredible opportunity. A big thank you to everyone in the audience for listening and being a part of this presentation. I had so much fun working on it, and I hope you all enjoyed it as much as I did. This is my contact information, so please don't hesitate to reach out if you have any questions or need more information. Thank you so much once again.